This message is brought to you by the U.S. Food and Drug Administration.
How you been feeling, Mr. Brown?
Pretty good.
It's a scenario that plays out thousands of times a day in America. A doctor writes a prescription, and then the patient takes it to the pharmacist who fills it with a manufactured drug that is FDA approved. However, there are some people for whom this scenario does not work. Patients with special drug needs that can't be filled by FDA-approved drugs. It's these patients who benefit from the practice known as compounding.
Well, compounding is when a pharmacist prepares a product following the instructions of a licensed prescriber, generally when the product is not available off the shelf.
Traditionally, compounding was part of the time-honored relationship between doctor, patient, and pharmacist. The pharmacist modified a medicine to a doctor's specific prescription, adding or mixing ingredients to arrive at a custom drug aimed at a specific patient's needs. Today, more than 30 million prescription drugs are compounded annually, many by honest, hard-working pharmacists who provide a much-needed service to their patients, people who depend on compounded drugs as a medical necessity.
She was about 5.5 months old. She woke up in the middle of the night with a terrible cough, and by the next night she was on a ventilator in the intensive care unit. What we discovered was that she had some rare anomalies, including she only had one lung and a very narrow trachea. So she went through extensive surgery to repair the airway. She was just so susceptible to infections, constantly getting sick. The antibiotics prescribed that any other parent can just go to the pharmacy and get were not going to work for her. So we had to have compounded medications, and I don't know what we would have done otherwise.
In this case, it's easy to see the importance of compounding and how it meets the medical need of an individual patient. But for all the good being done, patients may be exposed to dangers when using some compounded drugs.
We're really concerned about the quality of compounded drugs that come from certain pharmacies. Not all of them are equipped to compound the correct way.
Pharmacies that are regulated as pharmacies are not subject to FDA regulations on good manufacturing practices, and they may not have the same types of controls that FDA-regulated drug manufacturers have.
When you mix drugs together that haven't been tested, for example, together, they may inactivate each other, there may be drug interactions, they may degrade more quickly.
The FDA-approved product has been studied and looked at in that specific form. When you alter it, then you're changing its composition, and you can't say whether it's intact anymore for the safety and efficacy.
Bottom line is that a compounded drug has not really been tested to be safe and effective in clinical trials. We as pharmacists still evaluate the product, and based on the doses used or the concentrations, we can feel reasonably confident that the product is safe to use.
It may be difficult for a patient to know if the compounding is simple and can be done by most pharmacists, or whether special facilities may be necessary to ensure the safety of a compounded product. Take, for instance, a woman whose chronic back pain was finally eased by injections of a compounded drug that is normally taken in pill form for gout. She had been taking the medication for years until a calculation error made by the pharmacy led to an injection with 8 times the normal dose. It was enough to kill her and at least 2 others who were given the drug.
In that case, the pharmacy did not have appropriate quality controls and therefore released a super potent product, and several patients were harmed as a result.
While there are those who claim the risks to patients are non-existent, the FDA regularly sees reports of adverse events associated with compounded drugs.
For us, it's very difficult because there may be lots of adverse events that are occurring when patients take compounded drugs. However, we don't know about them.
Here are some things to remember about compounded drugs and the pharmacies that make them. Compounded drugs are not FDA approved, they have not been proven safe and effective by the FDA. There are both risks and benefits associated with them. Know why you're taking a compounded drug over a conventional prescription medication. A pharmacy's FDA registration does not guarantee that its drugs are approved or its products are made under the stringent conditions required by FDA. Doctors should not substitute compounded drugs for FDA-approved ones unless there is a patient-specific medical necessity. Doctors should make it clear to the patient and pharmacist when a drug is to be compounded and why it is medically necessary. If you notice that the compounded product you receive from your pharmacy tastes, smells, or looks unusual, do not take it and report it to the pharmacy immediately. Report any adverse events associated with compounded drugs to FDA through the MedWatch program.
FDA is trying to ensure that all drugs that U.S. consumers get are safe, effective, and high quality.
FDA is committed to protecting and promoting the public health. Keeping these tips in mind should help pharmacy compounding to remain a safe and viable solution for those who need it.